Okay, Ashok, now you have been part of Medicare for the last 15 years.
Yes.
Now, I think you are the biggest hospital group in the country and looking after large amounts of patients.
Yes.
And what are your new plans as far as the medical care is concerned in Sri Lanka now?
Yes. So obviously, doctor, that we want to continue to lead the industry. There's no question about it. Now, as you probably know, that we have 6 hospitals, 3 in Colombo, and we have a fantastic new hospital in Kandy. And also we got 2 hospitals in southern province, Mathura and Goal. So altogether we are close to about 900 beds. And you know that we have brought everything into the country when we have a cancer center.
Yeah.
So I think, if you look at cancer is a very, if you look at the number of cancer patients today, it's increasing, right? And probably maybe because people are living longer. So I think we are also looking at, I know there are so many cancer centers are coming up with a lot of donations, but we feel that, we need a full comprehensive cancer hospital by the private sector. So that's one of our plans.
Excellent.
So most probably within the next 2 to 3 years, we want to do that. We have plenty of land available within our premises. So probably Kula Road, our main, where we started this journey, we want to set up a comprehensive cancer hospital.
Right.
That's one. And the other point also, doctor, as you may know, right, medical tourism is a massive opportunity for Sri Lanka, especially.
Yeah.
There are, if you look at our part of the region, SAARC region, lots of medical tourism is happening within. Maldivians used to come here, they are coming here still, but that's a smaller number. But then at the same time, there are Bangladeshis, they are
a huge population.
Huge population, about 180 million population. So they, they patronize a lot of Indian hospitals currently, and they also go to Thailand. And with all these bilateral issues at the moment, between those countries,
that market.
I think that there is a massive opportunity where Sri Lanka can capture this market.
Absolutely.
So we are, very much driven on that idea. We believe, right, that maybe our next phase of growth for our hospital, it will probably not only for us. If we start as the leading hospital, I'm sure all the other hospitals also will get benefit.
Absolutely.
And not only the hotel hospitals, that obviously the hotels will get benefit, the entire country will get benefit. Right. So I think, that's something that we are very much focused on, and we would want to work with the government, because private sector alone cannot build a medical tourism market. We also need the government support.
You need from door to door.
Door to door.
They should be received well.
Absolutely.
And transported well.
And also we should participate in, there are conferences, exhibitions for medical tourism globally. I think we should be there moving forward. And just like how the government is promoting tourism, this is also part of tourism.
Absolutely,
right? So I think, we are also in touch with the government. I also have spoken to the Honorable Tourism Minister. He's very receptive. And so we will work on that.
Excellent. Because I think the tourism industry is doing as a whole very well in the country today.
And our GDP, and then also with all these problems that we are coming out of, shortest way to come out of it is the tourism. Right.
Therefore, you have experience in running airlines, Sri Lankan Airlines, and then also the hospitals and also many other companies.
Yes.
And I think if you put all your group strength, I think you can deliver good product.
I'm sure. I think that we are very hopeful that we have already done a lot of groundwork, and that will benefit the country as well.
Ashok, out of all the businesses that you do, in all the, from mobile phone to every other thing, what's the most satisfying business as far as you see it?
See, healthcare.
Do you see the healthcare is satisfying?
Because healthcare is not only...
Do people thank you?
Correct.
No.
Lots of people.
There are lots of people. No?
And also we help lots of people who can't afford private sector healthcare. And we do free heart surgeries every year. And that also we are selecting children.
Right.
And nominated by the Lady Ridgeway.
All right.
Right. That means only the well-deserving cases, and we don't pick and choose. They recommend to us. So that is part of the social, aspect that we are looking at. CSR. At the same time, that it's a very satisfying thing for me.
Absolutely.
It's not only about making money. The service that we have done to the country.
Absolutely.
Right. Healthcare is health is wealth. Right. Our future is all about health. So I think in that perspective, we are very
I
Happy?
think you have touched many lives in Sri
Maybe.
Lanka than many other guys in the country. And then also, if not for you, I think a lot of doctors would have taken the next flight and gone abroad.
Correct.
You know, because they know they want to make some extra money to
Absolutely.
live
And
in this
also,
country.
they also want to work with the
Yeah.
latest equipment,
Absolutely.
and they don't want to. They want
Boys
to keep
always
that
need
knowledge.
boys always need the toys.
Correct. Correct.
Because
Correct.
otherwise, they get frustrated.
Absolutely.
They get frustrated because I think
Yes.
your neurosurgical
Correct.
facility
Yes.
is enormous.
Yes.
If you really see, a lot of people can come out of heart.
So, doctor, I can tell you now that probably that we have plans to do robotic surgeries.
Right.
We will probably invest the. I mean, we will be the first. I think most
but
probably
it will
to
be a
invest
huge
in that.
investment.
Yes, but we have to do that.
Yeah, absolutely.
Because if you want to cope up with
Right.
what's happening in the region, if you go to
Correct.
India today,
Yeah, there are a lot of
all the top hospitals are doing robotic surgeries. So I think that's something we have already decided, and hopefully that'll be the first time in Sri Lanka.
All right, excellent. That's great. Thank you very much.
Thank
Ashok.
you.
Thank you for
doctor. Thank you.
being part
Thank
of
you
the
for
Medicare as
always
well.
being with us
Thank you
and
so much.
supporting
Thank you
us.
so
Thank
much.
you. And all the best for your exhibition.
Thank you so
Thank you.
much.